All right. Okay. So, welcome for the screening guidelines session. Like I said before, one of the priorities for MCC QE1, health promotion and illness prevention. Part of it is screening guidelines that is included in that priority, okay, of the blueprint stuff. So I'll go through some of the common things. And like I said before as well, I like to make any classes, these classes, any classes that I do, extremely interactive. I want to make sure that you guys get enough exposure to things. Your mind starts thinking about things as you see this because in the end, it's all about Canadian context and learning how to answer questions nicely and learning how to understand these questions. It's all about that, right? So with the screening guideline stuff, we will talk about breast, lung cancer, and few more. We will keep adding as more and more guidelines keep coming in, right? So these are some of the guidelines here. We have the newer one that was added, I would say like a year or two ago about chlamydia, gonorrhea one as well, STI screens. So we will add that too and so forth. All right, so let's begin with breast cancer. Okay, so breast cancer screening we do. What is the screening method of it, everyone? What is the screening method? Very good. Mammography, right? So screening method is mammography. And what is the age that we start? Age that we start? Very okay. So now we have some confusion going on. Is it 50? Is it 40? Is it 50? Is it 40? All right. So previously, right? Previously it used to be 50. Okay. Now the newer guidelines are working on making it at age 40. Okay. Newer guidelines are working at age 40. So a few weeks ago, I checked this one, Canadian Preventive Services Task Force website. Okay. And there is a recommendation. However, it is not become a full guideline yet. I haven't checked in last few weeks. So if it has changed, let me know. Otherwise, it is continues to be 50 for now, right? Every single province, yes, exactly, patient wishes than 40. Every single province has a different set of recommendations, but we follow Canadian Preventive Services Task Force guidelines. And I will show you, I'll take you to the website as well. And we can take it from there. Good. Okay. Age to start, we did age to end. So what is the age to end, everyone? Okay, very good. 74, like most of the things, good. And what is the duration? So how frequently should we do it? Every 1 year, every 5 years? How should it be? 2 to 3 years. Very good. Very good. It's every 2 to 3 years. So let's say if there's like slightly higher risk, we can do 2 years. If it's completely normal, we can do 3 years, but it is 2 to 3 years, right? So 50 to 74, right? 2 to 3 years mammography is the recommendation. Please make a note that the guidelines that I'm showing over here are 2018. These are currently changing, right? So according to the Canadian Task Force on Preventative Care recommendations, these guidelines are currently changing. So please make a note of this, right? Do not just blindly follow this. If these guidelines change, you have to use a new guideline in your exam. Okay, let's move towards lung cancer. So for lung cancer, first and foremost, do we have a screening method? Yes, no, yes, no. Do we have a screening method for lung cancer? Yeah, no. Yes, we do. We do have a screening method. Okay. So what is the screening method? Is it mammography? What is it? It is low dose CT scan. Nice. Very good. So it is a low dose CT scan is the method, right? And at what age do we normally start? What age do we normally start? 55. Okay, 55 and over. What age do we end? Is there an age to end? They haven't mentioned it, right? They haven't mentioned it much. 74 is something we take it as cutoff, but they haven't mentioned it because I'll tell you what is the criteria and how do we do it, right? So in who do we do this? So which patients qualify for low dose CT scan? Tell me. Very good. Anybody who has a smoking history, right? Smoking history of 30 pack years, right? 30 pack years, right? 30 pack in 15 years. Let's take a look. What are they talking about? Okay. So 30 pack year smoking history who currently smoke. So either they are smoking or they quit 15 years ago, right? They quit 15 years ago. So 30 pack year smoking history who are either smoking currently or they quit 15 years ago, right? That's one. Okay. And what else? Quit 15 years ago. And how many times do we do it? Very good, Dr. Huda. It is annually. Annually, we do up to 3 times, right? So every yearly we do up to 3 times. So this is usual detection, right? Now, we have talked about breast cancer stuff. We have talked about lung cancer stuff. Let's talk a little bit about questions, like how can they ask you questions and things like that, right? So very simple. 56-year-old male who has been smoking a pack a day since he was 18 years of age has come to your office today. What might you recommend to the patient? Option number one, um, CT scan of the chest. Option number two, hemoglobin. Option number three, urine culture and sensitivity. Option number four, CT scan of the head. Option number five, MRI of the chest. Okay? Everyone understands? That's how they frame question. Okay. Right now, it's easy for you because we are doing this screening guideline session. So for you, it's easy to identify that. But when you have 100, 200, 300 questions, you are going through these questions one by one, you start scratching your head. You're like, okay, am I looking at lung cancer here? Smoking? Am I looking at COPD over here? What am I doing? Is it pneumonia or something going on? Should I do like a chest X-ray? Or, oh my God, right? So to prevent that, make sure that you get acquainted with this style because they can just randomly throw things to you. Okay. And when they randomly throw things, many times you just have to prevent complicating the question more. Think of simple answers. Okay, good. So that's your smoking, lung cancer screening guidelines. Please note, chest X-ray is not recommended for it. Okay, good. Okay, colorectal cancer. So this has, in recent year, colorectal cancer has received a lot of attention, right? A lot of attention. Why? Is because more and more young people nowadays are diagnosed, right? More and more young people nowadays are diagnosed with colorectal cancer, right? So this has received more and more attention. Okay. So for colorectal cancer, what is the screening method, everybody? What is the screening method? So there is a fit test we do. Very good, Dr. Huda. So one is a fit test. Good. Anything else we have for colorectal cancer? Very good. It is sigmoidoscopy. Okay. Please remember, Dr. JK, just kidding. It's not colonoscopy. Okay. It is sigmoidoscopy. FOBT, we don't do anymore. Maybe some jurisdictions might be, but now we do FIT, fit fecal immunochemical testing. Okay. Uh, what is the frequency of it? What is the frequency of testing fit? How frequently should we do it? And how frequently should we do sigmoidoscopy? So let's talk about fit testing. How frequently should we do it? Every 5 years? 2 years. Very good. So fit testing we do every 2 years. Good. And what about sigmoidoscopy? Every 5 years sigmoidoscopy? Anyone else? How frequently should we do sigmoidoscopy, everyone? 10 years. Okay. Every 10 years we should do sigmoidoscopy. Okay. At what age do we start screening? At what age do we start screening? We start screening at 50, 50. Okay. And at what age do we end? At what age do we end? Very good. Most of them are same, right? Except pap smear, most of them end at 74. Okay. Except pap smears, most of them end at 74. So, yes, so Dr. JK brought a good point over here. Please remember these screening guidelines are for people who don't have any family history of colorectal cancer. Anytime you have a family history of colorectal cancer, these things change. Okay. So if you read in Toronto Notes, there is a big flow chart they have given, right? If somebody has, let's say, a family history of APC, polyposis coli, or HPNNC, hereditary non-polyposis coli, and that, then their frequency changes. Okay. It's like some is you start at like 18, 15, and all of that. If there is somebody who has first degree relative, you start colonoscopy at the age 40 or 10 years before the cancer was detected and all of that. So that you will have to memorize. It's just rote memorization. Okay. So take a look at the chart. Okay. Because those are exactly like what Dr. Nazir said, they're high risk screening guidelines. So just read it. If in case you need it, it'll be easier. Good. All right. So colorectal cancer screening we talked about, right? Please remember colonoscopy is not currently used as a screening test. Okay. We do send people for colonoscopy, but it's not currently recommended as a screening test. Good. Now the easier one is cervical cancer, right? So what is the screening method for cervical cancer? This is now changing as well. Okay, so current screening method for cervical cancer is pap smears, right? Is pap smears. In British Columbia, some other provinces, they have started HPV DNA testing, right? And this HPV DNA testing they do by a swab. So do doctors do it? No, usually. They mail the kit to the patient's house, right? The patient will do a self swab with it. So they do it by themselves, right? Put it in the vagina, swirl, take the swab out, put it in the sample container, and then send it to wherever the cancer agency is or the lab is. They will analyze and then they will let the family doctor or somebody or the patient know of what the results are. So currently, most of the provinces are doing pap smears, right? However, some have moved towards it. What do you have to remember? You have to remember again the Canadian guidelines, not the provincial guidelines. Okay. So we'll talk about pap smear. So pap smear, what is the age that we start? What is the age? Very good. Age to start is at 25. Okay. 25 is the age to start pap smear. And how frequently should we do it? How frequently should we do it? Every what? Every 3 years. Very good. Every 3 years we should do it, right? And at what age does it end? At what age does it end? Okay, very good. For normal people, pap smear ends at 69 years, right? For normal people, pap smear ends at 69 years if the previous three have been normal. If they haven't been, then you continue it until 74. Okay. Then you continue it until 74. Okay. What if someone is sexually active at an early age, right? So this was previously something that was quite controversial. We used to do PAPs and stuff like that, right? We used to do PAPs and stuff like that. Now we have HPV DNA testing and things. So we take advantage of that, right? We take advantage of that. However, majority of the cancers, when do they show up? Do they show up early or do they show up late? When do cancers show up? Do they show up early or late? Late, exactly. Majority of the cancers, right? The majority of the cancers, they show up at later ages, right? Majority of the cancers, they show up at later ages. And that's the reason why pap smear testing at 25 seems to be appropriate, right? Ontario has different guidelines. Ontario does it at 21, right? So provincial guidelines change, but all you have to follow is the Canadian Task Force guidelines. Good? Okay, prostate cancer. So what is the screening method for prostate cancer? PSA testing. Okay, that's the screening method. All right. At what age do we start? No age. So can a 2-year-old male can do it or what? 40? Okay. 50? So some say 40, some say 50. Okay. What age do we end? Okay, no screening for prostate. Okay. Okay, all right. So, what is the deal with prostate cancer screening? So, for prostate cancer screening, ideally, according to the Canadian Task Force guidelines, the screening is not recommended. Okay, the screening with PSA is not recommended. Why? Because there is a discrepancy between the risks and the benefits, right? Discrepancy between the risks and the benefits. So, does Canadian Urologist Association, all the urologists, do they indicate that PSA testing should be done? Yes, no, yes, no? Yes, they do indicate it. However, our task force says it's not as much recommended. So we follow the Canadian guidelines, right? And then we move on with those guidelines. Okay. Okay. So most of the people think that cancer guidelines are done, so all the preventative guidelines are done. Is it true? It's not true. So let's talk about some more. Lipids. So do we do screening, cholesterol and stuff like that? Yes, no, yes, no. Do we do screening for cholesterol, lipid profile? Yeah, we do, right? At what age do we start? At what age do we start? Very good. Normal, 40. If there are risk factors, you can do it at any age. What do? We do lipid profile, right? We do lipid profile. And then we repeat it every 3 to 5 years, depending on the risk factors of the patient. If they change early, then you need to do it. Yes, exactly. You don't need fasting anymore, right? Um, you can do it every yearly or every 3 yearly in males, females as well, who are 40 years or are menopausal, right? Or if anyone has any of these risk factors, right? So let's say you have a 32-year-old male, okay? You have a 32-year-old male with diabetes. Well, you will do it, right? You will do their lipid profile. Or let's say you have a 22-year-old with HIV, you will do it. So your exam question can be something like this. A 22-year-old HIV positive male comes to your clinic. What, if any, will you consider at this point of time? And then there will be questions over there. The option number one, lipid profile. Option number two, screen for suicide. Option number three, stay away from him. Option number five, check if he has any bipolar disorder, right? So they'll have options like this and they'll be like, choose which one. So you choose the one that is most appropriate. Lipid profile, HIV comes with it. Good. All right. Blood pressure, right? Blood pressure screening, we do every visit. So this is simple, not much to do over here, right? So that's another one. Bone mineral density. This has changed. Okay. So these guidelines, they have changed. So I'll show you the old ones, right? And then we'll talk about the new ones as well. So what is a screening method for bone mineral density? What is a screening method, everyone? Very good. It is DEXA scan. It's also called bone mineral density scan, right? Bone mineral density scan. Good. What age do we start? Do you know? Okay, 65 used to be 50. Okay, let's talk about it. You know what? I'll do a free session on it and we will talk more about it. Okay. It's not the old guidelines. They are not, right? Previously, we used to do it at 65. That's not true anymore. The guidelines have changed. Okay. Yes, what Dr. Nazir said, we do it at 70. We have another risk factors to consider, all of that. But let me do us another session and we can talk about it in more detail. Good. Okay. What about AAA, abdominal aortic aneurysm? Do we screen for it? Yes, no, yes, no. Do we screen for it? No? Okay. Yes. Yes. Okay. Well, let's take a look. So what is the screening method? Canadian Society of Vascular Surgery, right? One-time screening ultrasound for men 65 to 80, female, same thing, but with smoking or cardiovascular history, right? Now, what does a positive family history mean? Somebody says, oh, do you have a positive family history, like of cardiovascular disease and stuff like that? What does that mean? Because I know a lot of people have confusion with this. It's like, yeah, he has positive family history of cardiovascular disease. So what does this mean? You're like, oh, well, yeah, my father had heart attack. Yeah, yeah. Mother had heart attack. Okay. Disease in first degree relative in age less than 50? No, right? No. First degree relative early age. What is that early age? So that is different for males and females. Okay. It is different. So for males, it is if they had, let's say, like a heart attack or anything like that, less than an age. If it's a female as well, less than a certain age. What age is it? No, I'm not talking about smoking or anything like that, right? So for males, it is 55 years of age. And for females, it is 65 years of age. So what does this mean? Okay. So let's say you have a patient named Robert, for example. Okay. And Robert says that, well, my dad had a heart attack when he was 54 years of age. So that means he has positive family history and he is high risk. So he needs to have a lipid profile done, Framingham risk scoring done, and all of those things, right? If Robert says that, well, I had my father and my father had a heart attack at 65, okay, or 64, okay, that's fine, right? It's not super high risk. Why? Because in males, cardiovascular disease is quite common after a certain age. So what you're looking for over here is actually premature, right? What you're looking for is premature cardiovascular disease. And when can you say something is premature, especially heart disease, is if it is less than 55 in males and less than 65 in females, that is called premature stuff. Good. Our last one for today was chlamydia and gonorrhea. Anyone knows? Should we be screening for chlamydia, gonorrhea? Yes, no, yes, no. Should we be screening for chlamydia and gonorrhea? The answer, yes, we should. Okay. Who should we screen for? Tell me the age. Age limit. Okay, less than 25 years of age, 21 years of age, all sexually active, we should screen. So 81-year-old sexually active, we should screen as well. Okay. No. Okay. What are the Canadian Preventative Services Task Force guidelines? So these are the new guidelines as well. So that's why a lot of you guys don't know about it, right? But these guidelines are age. There's an age limit to it, right? Anyone remembers? 30 years, less than 30. Do you guys remember or no? Less than, okay. Less than 30 annual screening, all right? Annual screening. Good. So these are some of the guidelines that we have to do. Okay. Let's pause here.